Hey everyone. We're going to talk about ADHD, which stands for Attention Deficit Hyperactivity Disorder. In this video, I'll explain how ADHD is diagnosed and what treatment options are available. Let's get started. What is ADHD? ADHD is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, and impulsivity. This condition often starts in childhood and can continue into adulthood, affecting social, academic, and work life. Why is it important to treat ADHD? People with ADHD have a much higher risk of experiencing issues like anxiety and suicidal thoughts compared to the general population. Studies show that the likelihood of having suicidal thoughts or attempts is about 3-5 times higher in people with ADHD. They are also 2-3 times more likely to suffer from anxiety disorders. This is due to the increased stress and anxiety levels caused by the symptoms of ADHD. These statistics highlight the importance of seeking mental health support and treatment for those with ADHD, as untreated ADHD can lead to serious mental health issues such as depression, anxiety, and suicide risk. Symptoms of ADHD. ADHD has 3 main symptoms: attention deficit, difficulty in maintaining focus on a task or topic for an extended period; hyperactivity, being unusually active and energetic; impulsivity, acting without thinking or reacting hastily. ADHD diagnosis process. Diagnosing ADHD involves a careful and comprehensive evaluation. Both the individual and those around them, family, teachers, play an important role in this process. Here are the steps of the ADHD diagnosis process. Clinical interview, history taking. Specialists observe the individual's behavior and conduct a detailed interview. This includes gathering information about the person's life history, challenges, behaviors, and the onset of symptoms. For example, a child who struggles to focus and moves frequently during class may be observed by teachers and parents and then referred to specialists. Observation. The individual's behavior, speech patterns, and emotional state are observed. Physical examination. Sometimes a physical exam is conducted to rule out other medical issues. Psychological tests, attention tests. Various tests are conducted to measure attention span and focus. Common tests include the Stroop test, trail making test, TMT, and continuous performance test, CPT, which assess how long an individual can maintain focus and how easily they get distracted. Intelligence tests, used to determine the individual's overall intelligence level. Examples include the Wechsler Adult Intelligence Scale, WAIS, Stanford-Binet Intelligence Scale, and Raven's Progressive Matrices. Personality inventories provide information about the individual's emotional state and personality traits. Tools like the Beck Depression Inventory or the Minnesota Multiphasic Personality Inventory may be used. Environmental assessment, school reports, teachers' observations, and academic performance are evaluated. Family interviews. Family members are interviewed to gather information about behaviors observed at home. Referrals to other specialists. Consultation with specialists in neurology, psychiatry, etc., if needed. Assessment using APA criteria. The diagnosis of ADHD uses criteria set by the American Psychiatric Association, APA, in the DSM-5. According to these criteria, ADHD symptoms must meet the following conditions: presence in 2 or more settings. Symptoms must be observed in at least 2 different settings, e.g., home, school, work, social environments. Duration of at least 6 months. Symptoms must persist for at least 6 months. Age appropriateness. Symptoms generally must have started before the age of 12. Attention deficit symptoms. At least 6 of the following: difficulty paying attention to details or making careless mistakes, trouble maintaining attention over long periods, appears not to listen when spoken to directly, difficulty following instructions and completing tasks, poor organizational skills, avoidance or dislike of tasks that require sustained mental effort, often loses necessary items, easily distracted by extraneous stimuli, forgetful in daily activities, hyperactivity and impulsivity symptoms. At least 6 of the following: fidgets with or taps hands or feet, squirms in seat, unable to stay seated in appropriate situations. Runs or climbs in inappropriate situations, unable to play or engage in activities quietly, often on the go, or acts as if driven by a motor. Talks excessively, blurts out answers before questions have been completed, difficulty waiting for their turn, interrupts or intrudes on others. Types of ADHD. ADHD is categorized into 3 main types: predominantly inattentive presentation, difficulty maintaining focus, with fewer or no hyperactivity, impulsivity symptoms. Predominantly hyperactive impulsive presentation, primarily symptoms of hyperactivity and impulsivity. Combined presentation, both inattentive and hyperactive impulsive symptoms are present. 5. Family and teacher observations. Observations from family members and teachers are crucial, especially for children. These observations help specialists gain a comprehensive understanding of the individual's behaviors across different settings. Criteria for ADHD diagnosis: symptoms present in multiple settings. Similar symptoms must be observed at home, school, and in social environments. Duration of symptoms. Symptoms must be persistent, not temporary, and significantly impact daily life. Developmental appropriateness. Symptoms must be more severe than expected for the individual's age and developmental level. Exclusion of other psychiatric disorders. Symptoms must not be attributable to other psychiatric disorders, e.g., anxiety, depression. Why is an ADHD diagnosis important? Appropriate treatment. Once diagnosed, appropriate treatment methods can be determined. Access to support services. Necessary support services can be provided at school, work, and in social settings. Information for family and environment. Family and the individual's environment can better support them with accurate information about ADHD. What happens after an ADHD diagnosis? After diagnosis, a treatment plan is created, which may include a combination of medication, behavioral therapy, educational support, and family therapy. ADHD treatment methods. Medication. Various medications can help manage symptoms of inattention and hyperactivity by addressing chemical imbalances in the brain. Behavioral therapy. Structured therapy methods help individuals improve their attention and behavior and develop social skills. Educational support. Special educational programs can be arranged to help children perform better in school. Family and group therapies. Involving family members in the process strengthens the support system for the individual with ADHD. Group therapies help develop social skills. What happens if ADHD is not treated? Untreated ADHD can lead to various challenges in adulthood, such as academic and work performance, difficulty performing well in school and work, leading to poor grades, job loss, or quitting jobs. Relationships. ADHD can affect social relationships. Inattention and impulsivity can negatively impact friendships, family, and romantic relationships. Time management. Individuals with ADHD may struggle with effective time management, missing appointments and deadlines. Risky behaviors. Untreated ADHD is associated with substance use, reckless driving, financial issues, and other risky behaviors. Emotional challenges. ADHD can cause depression, anxiety, and low self-esteem. High risk or challenging professions. Certain professions may be more challenging or risky for individuals with ADHD, including 1. Pilot. Requires high levels of attention and quick decision-making under stress. Surgery. Demands prolonged focus and precision. 3. Police. Requires attentiveness and quick response times. Professional driving. Needs sustained attention and focus. Financial consulting. Involves attention to detail and long-term planning. Living with ADHD. Here are some tips to help individuals with ADHD manage their daily lives. For motivation and focus, set short-term and achievable goals, and use rewards to encourage progress. Organization. Establish daily routines and maintain a structured workspace. Regular exercise. Physical activity can help improve focus and manage energy levels. Mental exercises. Engage in activities like solving puzzles, playing Sudoku, and playing chess to support brain function. Stress management. Use techniques such as meditation and mindfulness to reduce stress. Conclusion: ADHD is a manageable condition. With the right treatment and support, individuals with ADHD can lead more productive and balanced lives. I hope this information has been helpful to you. If you have any questions or would like to share your experiences, please leave a comment. Don't forget to subscribe to my channel and like the video. Take care and stay healthy.